Okay, so this is assignment 7 for our case study for group 3. It says Jim, Susan's 38-year-old male cousin, goes to his nurse practitioner. He complains of heartburn that wakes him up at night. He's overweight, admits to enjoying fatty foods, and usually lies down on the sofa and watches TV after dinner. I feel like he is every American. He also complains that lately he has been having a cough and some wheezing. He is diagnosed with GERD. Question 1, explain the cause of heartburn and why it becomes worse after eating.
So according to, it's on page 1174, reflux means return movement, but in the case of gastroesophageal reflux or GERD, it refers to the backwards movement of the gastrointestinal, what's in the stomach. So the reason why it happens after they eat is because that comes back up.
And it's due to the relax.
What was that?
It's due to the relaxed esophagus sphincter, like a weaker, I think it's incompetent lower esophageal sphincter.
Incompetent. Lower. Gastric. Okay.
It also says that a small percentage of people who complain of heartburn have mucosal injury. Usually occurs during the night. So that's when you produce the most acid.
It also says in here, delayed gastric emptying also can contribute as it increases gastric volume and pressure. And then it also decreased salivation and salivary buffering capacity may contribute to impaired clearing of acid reflux from the esophagus.
Okay, say that first part again.
First part, delayed gastric emptying. Due to increased gastric volume and pressure with, no, just pressure. That was the end of the sentence.
Okay. Is it still on page 1174?
And 1175.
Yeah.
Yep.
Okay. So I have refers to the backwards movement of gastric contents possibly due to incompetent lower gastric sphincter and mucosal injury due to diet. Occurs during the night due to reclining and delayed gastric emptying due to increased gastric volume. And you said something about pressure?
Yes, gastric pressure.
Increased volume and pressure. Okay. Does that sound good?
Perfect. Yes.
Okay. Second question. Persons with GERD are advised to lose weight, avoid fatty foods, remain sitting after eating, and sleep with their head slightly elevated. Explain possible relationship between these situations and the occurrence of reflux. So fatty foods actually damage the mucosal lining due to their lipid solubility. I don't know what page that's on, but I remember reading that. I'll find that.
So sitting up or sleeping with your head elevated helps to prevent the reflux during the night, which is on 1175 in the treatment section.
And it said avoidance of large meals and foods that reduce lower esophageal sphincter tone. So like caffeine, fats, and chocolate. So avoiding of the fatty foods then would help not to reduce the lower esophageal sphincter tone. And that's in the treatment area also.
Examples are caffeine, chocolate,
And fats. Mm-hmm.
fats. And isn't smoking in there or something? I feel like I remember reading something about smoking, but maybe not.
About smoking somewhere too, but I'm not seeing it in this part.
I read that whole chapter today, and it's like 50 pages long.
Yeah.
On 1176, it said that weight loss usually is recommended in overweight people, but that's all it says.
Yeah, it doesn't say why.
And I even tried Googling it, and even like Mayo Clinic doesn't say anything like why. It just says that obese and overweight people should change their lifestyle. Oh, it says maintain a healthy weight. Excess pounds put pressure on your abdomen, pushing up your stomach and causing acid to reflux into your esophagus.
There you go.
There we go. Ta-da!
Okay, so I have, where am I at? Okay. Sitting up decreases reflux. Avoid large meals and avoid fatty foods, caffeine and chocolate due to, what's the word I want to say? Due to the fact that they reduce lower sphincter tone. I can't think of a word. I'll think of a word later. And then also weight loss is recommended to reduce abdominal pressure causing reflux.
Yeah.
Here it is. Avoidance of alcohol and smoking is also recommended.
Okay. And what page is that on?
1175. And it also says bending for long periods should be avoided because it tends to increase inner abdominal pressure. Of course, I guess it didn't actually ask about that, so we probably don't need it.
Yeah. I'll try and bunch some of those things together so they all look better.
Okay.
They're kind of all in there, but I think that's several of them. Okay, and then the last question is explain the possible relationship between GERD and the respiratory symptoms Jim is having.
It says on 1175, the reflux of gastric contents may produce respiratory symptoms, and it says that the proposed mechanisms of reflux-associated asthma and chronic cough include microaspiration, laryngeal injury, and vagal-mediated bronchospasms.
Okay, microaspiration, what are the other two?
Microaspiration and macroaspiration.
Okay.
Laryngeal injury.
You said epithelial injury?
Laryngeal.
Laryngeal.
And vagal-mediated bronchospasms.
Now, I can't find the page number, but from what I remember, when your body has acid reflux, it thinks it's vomiting, so it automatically tries to clamp down, which causes your eyes to water, your nose to run, all those type of symptoms, which correlate. Once those occur, then you start to have a cough. The runny nose can cause respiratory symptoms, but I can't remember what page it's on, but it's an automatic response because your body thinks that it's vomiting.
Okay.
Is it on 1174 somewhere?
Um, I don't see it on 1174. If I find the page number, I'll send it to you. I can't find it at the moment.
Okay. What were the causes? What were the symptoms that happen?
So you have watery eyes, runny nose, cough.
Okay. I know what you're talking about because I read that today too. So for this question, I put reflux of gastric contents due to micro aspiration, macro aspiration, laryngeal injury, and vagal-mediated bronchospasms. Also, the relationship, and I'm not sure how I'll tie the second sentence in. I said, due to the body's response to reflux as it simulates vomiting, which causes watery eyes, runny nose, and cough.
I wonder if that is.
There is like a whole section of where it talks about specifically vomiting. I wonder if it's in that section and not in the GERD section.
It might be. I remember reading it because it's a direct correlation response.
Mm-hmm.
I wonder if it's part of what they're talking. I mean, I don't know for sure because I'm trying to Google it right now just to be sure. But I wonder if that's what they're talking about when they're talking about vagal-mediated bronchospasms.
Mm-hmm.
That kind of sounds like a vagal response.
Yeah, it definitely could be.
I don't know. I'm Googling it right now.
I just know that I just remember the responses are watery eyes, runny nose, cough.
I'm reading all that, but I don't know why I can't find it in here. I thought it was under the children's section, but it wasn't.
I know, I was just reading that, but I don't think I found it anywhere in the children's.
But so that's the other thing that occurs.
Yeah.
That I recall. And I'll try to track down the page number.
Okay. So that sounds good. Does anybody want to add anything with those three? I'll type this up better so it doesn't sound so, crazy and send it out to you guys.
Sounds good.
Awesome.
I'm going to stop the recording.